Welcome. Have you ever experienced sudden, intense shoulder pain seemingly out of nowhere? Today we're diving deep into a relatively rare but incredibly painful condition called neuralgic amyotrophy, also known as Parsonage-Turner syndrome. We'll explore what it is, why it happens, how it's diagnosed, and what can be done to manage it. So, let's get started. What exactly causes neuralgic amyotrophy? The truth is, the exact cause remains somewhat of a mystery. However, it's believed to be an inflammatory or autoimmune response that damages the brachial plexus. This is the network of nerves that controls movement and sensation in your shoulder, arm, and hand. While it can sometimes appear spontaneously, certain factors are known to trigger or precede an episode. These include viral or bacterial infections, vaccinations, surgery, strenuous exercise, and even minor trauma. In some cases, it can also run in families, suggesting a genetic component, although this is less common. Now let's talk about the pathophysiology. The core of neuralgic amyotrophy lies in nerve damage, specifically affecting the brachial plexus. The immune system, for reasons not fully understood, attacks these nerves. This inflammation and subsequent damage disrupt the transmission of nerve signals, leading to pain, weakness, and even muscle atrophy in the affected area. In severe cases, demyelination, the loss of the protective coating around nerve fibers, can occur, further impairing nerve function. The severity and specific nerves affected determine the range of symptoms experienced. Neuralgic amyotrophy is considered a relatively rare condition. Estimates suggest that it affects around 2 to 3 people per 100,000 each year. It can occur at any age but is most common in young adults, typically between the ages of 20 and 40. Both men and women can be affected, but it appears to be slightly more prevalent in males. It's important to remember that these are just estimates, and the actual numbers could be higher due to underdiagnosis or misdiagnosis. The hallmark symptom of neuralgic amyotrophy is the sudden onset of severe pain in the shoulder or upper arm. This pain is often described as sharp, stabbing, or burning and can be excruciating. This intense pain usually lasts from a few days to a few weeks. As the pain subsides, weakness and muscle atrophy begin to develop. The muscles most commonly affected include those in the shoulder, arm, and hand, leading to difficulty with movements like raising the arm, reaching, or gripping. Sensory changes like numbness, tingling, or a pins and needles sensation may also occur. The specific symptoms and their severity can vary greatly depending on which nerves are affected. Diagnosing neuralgic amyotrophy can be challenging as there's no single definitive test. Diagnosis relies primarily on a careful clinical evaluation, including a detailed medical history and a thorough physical examination. Nerve conduction studies and electromyography, or EMG, can help assess the function of the nerves and muscles, confirming nerve damage and ruling out other conditions. Imaging studies like MRI can be used to visualize the brachial plexus and exclude other causes of pain, such as tumors or nerve compression. It's a process of eliminating other possibilities and piecing together the clinical picture to arrive at the correct diagnosis. While neuralgic amyotrophy doesn't have distinct subtypes, it can be classified based on its cause. Idiopathic neuralgic amyotrophy refers to cases where no specific trigger can be identified. Hereditary neuralgic amyotrophy, on the other hand, is caused by a genetic mutation and tends to run in families. Understanding the cause can sometimes help with prognosis and management. The treatment of neuralgic amyotrophy focuses primarily on pain management and restoring function. During the acute phase, pain relief is crucial. This often involves medications like NSAIDs, opioids, or nerve pain medications such as gabapentin or pregabalin. In some cases, corticosteroids may be used to reduce inflammation. Once the pain begins to subside, physical therapy becomes essential. Exercises are prescribed to strengthen weakened muscles, improve range of motion, and prevent contractures. Occupational therapy can also help adapt daily activities to accommodate any remaining limitations. In rare cases, surgery may be considered to release compressed nerves. Unfortunately, there's no known way to completely prevent neuralgic amyotrophy. However, minimizing risk factors may help. This includes avoiding strenuous activities immediately after infections or vaccinations, ensuring proper ergonomic setups to prevent nerve compression, and promptly addressing any underlying medical conditions. If you have a family history of hereditary neuralgic amyotrophy, genetic counseling may be beneficial. The prognosis for neuralgic amyotrophy varies. Most individuals will experience significant improvement over time, often within 1 to 3 years. However, complete recovery is not always guaranteed, and some individuals may experience persistent pain, weakness, or muscle atrophy. The severity of the initial attack, the specific nerves affected, and adherence to physical therapy all play a role in the outcome. Research is ongoing to better understand the underlying mechanisms of neuralgic amyotrophy and to develop more effective treatments. One promising area of research is focused on identifying specific genetic markers associated with the hereditary form, which could lead to targeted therapies. Furthermore, studies are exploring the use of immunomodulatory therapies to dampen the inflammatory response and prevent nerve damage.